start now?
Yes.
Every step we take in understanding mental health chips away at stigma and replaces it with support. As we continue this webinar, let's remember awareness is the first act of healing, and compassion is the bridge that connects science to the soul. Very good evening to all the participants to the day 7th of the free webinar series on psychological disorders, triggers to treatment. Before we start, let us have a quick recap on the journey till now. We started with an overview of the webinar on day 1, and then our team at Manojagrithi took you through the journey of generalized anxiety disorder, postpartum depression and premenstrual dysphoric disorder, childhood disorder, all phobias, and yesterday we understood about schizophrenia. Now what today? Today we are going to present Swatina Shashi, and Ms. Madhavi Singh from Manojagrithi are going to present on the topic major depressive disorders and bipolar disorder. Manojagrithi is a team of mental health professionals dedicated to promoting mental well-being with the belief that harmony between mind, heart, and will makes anything possible. Their vision, instead, our vision is to raise awareness, prevent mental health issues, and help build a value-based healthy nation. Sudisha. Sudisha Counseling Center is a unit of Manojagrithi working towards creation of mental health awareness and offering screening and assessment and various other services that are highlighted on the screen. Now, I take this privilege to welcome the visionary minds behind this enriching webinar series, Dr. Geetha Challa, counseling psychologist and founder director of Manojagrithi, and Ms. Vijay Lakshmi, coordinator of Sahaya, the diploma course in counseling. I would like to take this opportunity to thank you for trusting us and giving us this opportunity to share our knowledge on this platform. Thank you so much, ma'am.
Before we dive deeper into today's session, let's take a few moments to center ourselves with conscious breathing, dot breathing, and grounding techniques. These simple techniques can help us stay present, calm, and focused. Select calm, serene place without any disturbance. Sit in an upright position comfortably. Rest your hand on knees. Be relaxed and close your eyes. Now let us start with conscious breathing. Please focus on your nostrils. Observe the air you breathe in and the air that you breathe out. Please inhale, exhale. I repeat again, inhale. Please focus on your breathing. Exhale. One more time. Inhale, exhale. Relax, relax, relax. Now we move to the dot breathing. Slowly open your eyes and keep the dot breathing paper in front of you. In dot breathing, we will keep the index finger of our dominant hand on each number in reverse order while we inhale and exhale. We move our finger to the next number and continue till we reach number 1. Now, keep your finger on number 10. Inhale. Exhale. 9. Inhale. Exhale. 8. Inhale. Exhale. 7. Inhale. Exhale. 6. Inhale. Exhale. 5. Inhale. Exhale. 4. Inhale. Exhale. 3. Inhale. Exhale. 2. Inhale. Exhale. 1. Inhale. Exhale. Let us now move ahead with the grounding technique that help in emotional regulation, improve focus and productivity, and encourage mindfulness. Let the next few moments be just for you. Being mindful and non judgmental, tapping into our five senses one at a time. Softly close your eyes. We will begin by tapping into the sense of hearing. Notice or observe five sounds you can hear. Perhaps your own breathing, a bird outside, the hum of a fan, playing children, or distant traffic. Let each sound anchor you gently to the now. Do not judge or interpret the sound, just listen. Feel each sensation fully. Let it remind you you are here in this moment. Now, gently shift your attention to your sense of touch. Notice four things you can feel: the weight of your body on the chair, the cool air on your skin, the fabric of your clothing, the way your feet press into the ground. Feel each sensation fully. Let it remind you you are here in this moment. Now turn to your sense of smell. Notice three smells around you. Maybe the scent of the room, fresh air from a window, your clothing, or even the absence of smell. If you can't experience any smell, that's okay. Just notice what's there or recall a favorite scent in your memory. Feel each sensation fully. Let it remind you you are here in this moment. Slowly rub your palm until they are warm and then place them on your eyes gently. Feel the warmth of the palm. Please slowly open your eyes. We now tap into the sense of sight. Please look around you. Notice two things you can see. They don't have to be special, just observe. Perhaps the texture of the wall, a beam of light, the shape of your hands, the way shadows play, or the color of something near you. Slowly observe one by one. Do not rush. Feel each sensation fully. Let it remind you you are here in this moment. Let us gently tap into the last sense, the sense of taste. Take the resin in your hand, observe it, keep it in your palm, and observe its shape, color, texture. Smell the resin and observe if your mouth is watering. Now slowly place the resin on your tongue, but do not bite it yet. Let it sit there. Feel its surface. Observe the way it brings the taste sweet. Observe it. Let it dwell around all the corners of your mouth while observing all the senses it activates. Now slowly and mindfully chew it and follow the entire journey of that resin in your mouth until it disappears and is swallowed down. Take one final slow deep breath. Inhale, exhale. Feel your body settle fully into the now. Feel the sensation fully. Let it remind you you are here in this moment. You have just grounded yourself. You are present, safe, calm, and focused. When you feel ready, gently wiggle your fingers and toes and bring yourself back into the room aware, steady, and ease. As we begin, gently remind yourself, I am here to learn, to grow, and to be fully present. Welcome to this shared space of learning and reflection.
That was really relaxing, Madhvi. And I'm sure we all have grounded in the present. So let us start with our presentation. So today we are going to discuss about major depressive disorder and bipolar disorder. So the agenda of the day will be, we will talk about what is MDD, that is major depressive disorder, and bipolar. We will be talking about the definition and we will be referring to DSM criteria. We will discuss the prevalence, symptoms, and causes of these conditions. Then we will talk about the screening tools, the diagnosis, the treatment, the therapies, and how self-care and management can help a person having or experiencing these conditions. Before we start, I hope you all are able to see few pics on the screen. I just request all the audience to type in the chat box the emotion they are able to relate to the pictures. I repeat, I request all the audience to please type in the chat box the emotions that they can see in the pictures given on the screen. Madhvi, can you help me reading these emotions or the responses?
Yes, ma'am, I can see a few responses that say these emotions like low mood, sadness, and disturbance, disturbed mood, etc.
Yeah, I can even see sleeplessness, mood
Mm,
depression, stress, lowness, okay, and then gloomy. Yeah, we can see all this, but then I'm also seeing the word depression along with this. So, do you think sadness, low mood, and depression are the same?
maybe, ma'am.
No. Let us first clear this confusion that we all have in our mind. Depression is a term which is very freely used, very easily available for people nowadays. Any small disappointment, and they say that they are in depression. But then let us start with the clarity of what is depression, what is sadness, and what is low mood. So, sadness, low mood, and depression differ significantly in their nature, intensity, and impact. Sadness is a natural and temporary emotional response to a specific life event like disappointment or loss of something, which usually fades with time and does not interfere significantly with the daily life. Means the daily routine will be normal and it will be a temporary phase. But when you talk about low mood, on the other hand, it is also a short-term emotional dip. But then again, it is something that is in, that can be triggered by tiredness, irritability, or disinterest in certain things. But then again, even low mood is something that can be generally improved by taking rest or even by making small lifestyle changes. But when it comes to depression, we all need to really understand that it's a clinical condition and it goes far beyond everyday sadness or low mood. It lasts for at least 2 weeks, severely affecting your day to day life, your routine, and it usually requires, it's not something that will fade away naturally or with lifestyle changes. It actually needs proper professional treatment through therapy, medication, or both. So now I hope you have got a clarity.
Now we will continue with different type of depressive disorder. According to the DSM-5 depressive disorder, the following are the disorders that fall under the umbrella of depressive disorders. 1. Major depressive disorder. 2. Persistent depressive disorder is also called dysthymia. 3. Disruptive mood dysregulation disorder. 4. Premenstrual dysphoric disorder. 5. Substance or medication induced depressive disorder. 6. Depressive disorder due to another medical condition. 7. Other specified and unspecified depressive disorder.
Now, knowing all the depressive disorders that come under DSM, let us now today focus on the major depressive disorder. But before we go into the understanding of MDD, that is major depressive disorder, we need again a small clarity on what is the difference between MDD and PDD, that is major depressive disorder and persistent depressive disorder. Major depressive disorder involves a severe depressive symptom that lasts for at least 2 weeks and may occur in cycles. In contrast to this, PDD is characterized by a chronic low level depression lasting for 2 years or more in adults and 1 year in children. So, the period of the mood depression is really huge. Major depressive disorder is 2 weeks, whereas PDD is at least 2 years or more. And these symptoms, like when you think about the symptoms, they may be less severe. Like PDD symptoms may be less severe than MDD, but they are more enduring. While MDD can be disabling during episodes, PDD can cause long-term sense of gloom and self-esteem, low self-esteem.
Now we know prevalence in global context. According to the National Mental Health Survey, the global burden of depression has been increasing, with major depressive disorder being the third leading cause of disability. Estimated global prevalence of MDD varies from 3.2% to 4.7%. Prevalence in Indian context. According to the Public Health Foundation of India, around 197 million Indians, or roughly 1 in 7, suffer from mental disorder. Almost 45 to 46 million people suffer from MDD. The prevalence of depression is particularly high in older adults. Prevalence in Telangana. A report in the Times of India indicated Telangana had the third highest incidence of depressive disorders among Indian states. Introduction of major depressive disorder. Major depressive disorder, also known as clinical depression, is one of the most common and severe form of depression studied in the psychology. As per Diagnostic and Statistical Manual 5, MDD is classified as a mood disorder that is characterized by persistent feeling of sadness, hopelessness, and loss of interest or pleasure in most activities. MDD affects a person's emotional, cognitive, behavioral, and physical functioning, interferes with daily life, relationship, and occupational or academic responsibilities.
Now, how do we recognize when do we need help? So let us know the symptoms of MDD, major depressive disorder. Major depressive disorder, MDD, is diagnosed when a person experiences for at least 2 weeks either a persistent low mood or a marked loss of interest or pleasure in nearly all activities. Importantly, these core symptoms must be accompanied by at least 5 additional symptoms that reflect insignificant change from a person's usual function. So out of these 9, the person should also experience minimum 5 of them. These 9 are depressed mood almost daily or like most of the day, marked diminished interest or pleasure, significant weight loss, insomnia or hypersomnia, psychomotor agitation or retardation, fatigue or loss of worthlessness, diminished ability to think, and recurrent thoughts of death. When you think about child or children with MDD, they may show up irritability, sadness, loss of interest, and change in sleep, appetite, or energy. They may struggle in school, they may withdraw from others and like to be in isolation or express hopelessness. These symptoms, even in children, should be seen at least for 2 weeks and it should show an impact on their daily life. Then we can diagnose it as MDD. Now, when I'm talking about the impact of MDD on life, depression, it can like major depressive disorder can impact a person across many areas of life. Mentally, it involves negative thoughts, poor focus, and sometimes suicidal ideation. There may be sadness, hopelessness, or guilt. Physically, the person with MDD feels fatigue, sleep and appetite changes, and aches. The person's behavior changes. He is seen withdrawing from the society, neglecting responsibilities, and using substance. Socially, you can see, as I said, that isolation is the major symptom. Strained relationships and reduced social involvement. All these worsen the mental health stigma that they are going through.
Now we will explore the possible causes or triggers of MDD. MDD can arise from a mix of biological, psychological, and environmental factors. Biologically, it may run in families and is linked to brain chemical imbalance, hormonal changes, and difference in brain structure or function. Psychologically, negative thinking pattern, low self-esteem, perfectionism, and early life trauma increase at the risk. Environmentally, stressful events like loss, loneliness, or chronic illness can trigger or worsen depression. Other factors include certain medications and seasonal changes such as reduced sunlight during winter. Role of neurotransmitter in major depressive disorder. Major depressive disorder is connected to low level of brain chemicals called neurotransmitter, mainly serotonin, dopamine, and norepinephrine. When these chemicals are low, it can lead to symptoms of depression. Antidepressant medicines work by raising their levels, which helps improve mood and reduce depression.
After knowing the causes, now we know the symptoms, we know the causes. Now let us know how to diagnose this. What are the screening tools that are available? Several tools help screen the major depressive disorder. They are all listed on the screen. But with this, we can understand that PHQ, that is Patient Health Questionnaire 9, is the most widely used one. Others include the Beck Depression Inventory or the Major Depression Inventory. These tools aid in early detection, assess the severity of symptoms, and help track progress during the treatment. But wait, there is a disclaimer. People usually try to do a self assessment. Now, knowing the screening tools, it doesn't mean that we can do a self assessment and diagnose our MDD, but it is actually to be done under the supervision of licensed authorities. So, please spread this among your people around you that whenever they are going through these symptoms are just an indicator to that indicate us to take or seek help from licensed authorities. We are not the one to screen and assess our or diagnose our condition. Now, when we are talking about diagnosis, when we are talking about symptoms and causes, let us understand the treatment. What plays a major role? So you can see a balance here. Major depressive disorder is a disorder which needs medication and equally needs counseling. So both the treatments go hand in hand. Managing this MDD requires both of them Because medication addresses chemical imbalances, while counseling helps individuals understand emotions, build coping skills, and heal from underlying issues. Together, they provide more effective and holistic path to recovery.
When it is about counseling, there are various therapies that are used for MDD, like CBT. CBT is cognitive behavioral therapy, which is the most widely used therapy for MDD. Second, interpersonal therapy that focus on improving relationship and communication. Third, mindfulness based cognitive therapy that combines CBT with mindfulness technique like meditation and helps prevent relapse. Fourth, psychodynamic therapy which explores unconscious thought and past experiences. Fifth, supportive therapy, which counseling offers emotional support, encouragement, and guidance. Sixth, behavioral activation therapy, which encourages patients to engage in positive, meaningful activities. Seventh, group therapy, which involve guided therapy in a group setting with other experiencing similar issue. Eighth, family or couples therapy involve close family or partners addresses relationship issues that may be contributing to the depression. Combined approach is nothing but when therapy and medication both are used to get the best result. So, what can one do to keep themselves stable?
There is technical glitch. Just wait a minute.
Madhavi,
Yes, ma'am.
do you need any support?
Ma'am,
Yes,
Swatin is
ma'am.
about to join.
Acha. Swatina still
She
need to
got
join.
disconnected. Yes.
You're waiting for her. Meanwhile,
Yes, ma'am.
can we talk to the audience, participants?
Yes, ma'am. We can.
Yeah. So good evening, all of you. Let me know when Swatina joins.
Yes, ma'am.
Yeah. Meanwhile, can I have a very healthy discussion on depression? Because I understand that already you have been discussing about many things. So the question is here, extreme stress causes depression. Um, See, definitely stress has uh, direct relation with many of the mental health issues. So stress sometimes may lead to depression if it is not under control, but there is no direct relationship. But still, many a times stress causes mental health issues. What happens is when you are under stress for quite long time, at a point you start developing the emotions like helplessness, hopelessness, or feeling feeling guilt that I'm not able to do. So these emotions again, they turn into depression or low mood. So that's why we generally coined a word, that's a famous word, stress fit. So stress fit is like a well-being toolkit for all of us. Whenever you see the symptoms of stress, whenever you understand that you are getting into stress or you're experiencing extreme stress, normal stress is very common. We all, but then when it is going beyond and you are getting into that burnout state, you need to be very careful. Can we get stress
Yes.
kit online, ma'am? Okay.
Yes.
So someone is asking,
Yes.
Bhargav is asking about, can we get it? Definitely, we are actually planning to launch a program very shortly. Date not yet decided, but we are thinking about a stress fit program every day. It's a very challenging, but still we are trying to think how I can do it. So stress fit every day we are going to launch. You will be like, be in this group, continue in this group, you will get updates about it. So as we every day, do yoga, we go for walk, we think about healthy diet, and we do breathing exercises. Similarly, there is a need for us to practice well-being techniques. So that's where this stress fit well-being toolkit is coming up. We are trying to do it every day online. So we'll definitely invite you for that. You will join us. Meditation helps for depression. Definitely helps, but if you see the symptoms of depression, lot of low motivation, energyless feeling, tired feeling, sometimes they can't even get up from the bed. So meditation needs lot of concentration, lot of effort, lot of focus, and that the depression client or a person under having depression may not be able to do it. If that happens, definitely it helps, but generally they do not have that much energy, that much um, capacity to start getting into. Yesterday, not yesterday, 2 days before, I saw a client, very typical depression. She's experiencing since 2 years because of a trauma which happened 2 years back. And now she's in a state where she do not have any motivation to work on her depression also. And she feels helpless, and she do not see any light in front of her. So that hopelessness is also there, helplessness is also there, and low motivation, and she do not see any reason to work for herself. So what happens, in depression, before even we work for depression, we need to work for motivation. Because sometimes it happens, the depression becomes habituated depression. Habituation, it means they become little more comfortable in that depression. They're they're fine with it, and they don't want to work on it. This is what I'm not telling. A client told me 2-3 days back, I don't want to work for my depression. I don't have motivation. So better you don't give me any techniques. So that's what. Okay.
Thank you, ma'am. And I'm extremely sorry for the technical glitch.
No problem. No problem. Please go ahead. I questions at the end, again, please call me. I'm there.
Yeah, yeah. Thank you so much. Thank you so much. So let's continue. So, ma'am has already told about how we can manage things. So, Madhvi will continue with this.
Okay. Thank you, ma'am. So, what can one do to keep themselves stable? We can do some activity like physical activity, walking, jogging, yoga, stretching, or dance. Some creative activities like drawing, painting, journaling, music, listening, and singing. Some mindfulness and relaxation activities like meditation, breathing exercises. Some social activities like talking with a friend or loved one, joining a support group online or offline. Volunteering create purpose and connection. Some structured activities like setting a daily routine, creating a small to-do list, goal setting which encourage progress in your routine.
Thank you, Madhvi, for that self-help techniques that you told us. Now, in psychology, in counseling psychology, we have an intervention called storytelling, which is considered as one of the most effective techniques because since childhood we have been learning, or half of our learning is through stories. So let us here listen to the story of a little lamp in the fog, a calming story for those walking through the fog of depression. In a quiet valley surrounded by soft, there lived a little lamp. It wasn't the biggest or the brightest, but it was something special. It never stopped glowing, even in the darkest night. For a long time, the valley was full of sunshine, and the lamp spent its day resting. But one season, a thick fog rolled in and didn't go away. The skies turned gray, and the warmth of the sun like a distant memory. The lamp felt lost. What's the point of my life, light? It whispered. If no one can see it? The fog was heavy and it made everything feel slower, colder, and quieter. The lamp began to doubt itself. Maybe my life doesn't matter at all. But in that same fog nearby, a tired traveler wandered, feeling cold and unsure. She couldn't see the road ahead, couldn't remember what the sunlight even looked like. Then, faintly, very faintly, she saw a tiny glow through the mist. It was the little lamp. She followed its light. Step by step, she made her way to the lamp's gentle warmth. She sat beside it and rested. The lamp didn't speak, didn't shine. But then it was quiet, and its glow told her, you are not alone. And slowly, over many days, the fog began to lift. None of them needed the lamp to shine like the sun. They just needed it to be there, quietly glowing, reminding them that hope exists even when hidden. The lamp at last realized, even in fog, my light still helps. Even when I feel dim, I still have enough, and I have enough to give to people.
Thanks, Swatina. That is such a nice and motivational story, helping the client understand that he is not alone in this journey and that he should not leave his hope on the journey back from MDD.
Yes, Madhvi. But then, this story reminds me of another friend that I have. She also goes through mood depression, but then hers is totally different. She behaves very weird.
Weird, like what?
Weird in the sense, her mood, like I can say, she has very drastic mood shifts. One day she's super energetic and talkative for some days, and then suddenly, some days she becomes like withdrawn from the society. She's quiet, she's like a total mood shift, I can see. And it is not how should I say, it is not on a daily basis. It lasts for long, then sudden change, then sudden change. So she has become a very unpredictable person now.
Ma'am, I think she might be struggling with something bigger than just being stressed or overwhelmed.
But then it has started worrying me. I'm worried about her.
Ma'am, though I cannot declare it without a proper diagnosis, but still I can guess she might be having bipolar.
What is bipolar, Madhvi?
We are discussing the same now. Our second topic is bipolar disorder.
Yeah.
Bipolar generally is a mood disorder, but recently it has been separately categorized in DSM-5. It indicates drastic fluctuation in mood, is that severe mood swings. Definition of bipolar disorder. According to the DSM-5, bipolar disorder is defined as a mood disorder involving one or more episodes of mania, hypomania, and or major depression which significantly affect functioning. These shifts include periods of mania or hypomania, present high mood, feeling overly happy, energetic, or irritable. Let
Hmm.
me give you an example. Samir walked into the mall for socks and came out with designer shoes, a drone, and a vintage guitar. I have never played, but I will learn, maybe even start a band, he told the cashier confidently. That night, he talked for hours about reinventing his life. His bank app blinked red, but his excitement drowned out the worry. Second one is depression presenting low mood, feeling very sad, hopeless, or tired. Just example, Ravi stopped looking in the mirror. He used to fix his hair, trim his beard, choose clothes carefully. Now he wore the same hoodie every day and avoided reflections. When his friend asked, "Want to come out?" Ravi shrugged, "What for? No one noticed me anyway." Inside he missed his old self, but a quiet voice kept whispering, "You don't matter."
Madhvi, the symptoms that you told me just now, I can relate. I can understand that my friend is going through the same situations. So I think we need to really discuss about bipolar.
Yes, ma'am.
So before that, let us see the prevalence. In the Indian context, the lifetime prevalence of mental health disorder is estimated to be around 1% to 1.5% in men and 3%, 1% to 1.7% in women. When we see the 12-month prevalence, it ranges from approximately zero point 0.3 to 0.6% in men and zero point 0.4 to 0.7% in women. While overall prevalence rates are relatively similar across genders, the way symptoms are experienced and expressed can vary significantly between men and women. And bipolar also impacts the daily routine of a person. A person feels cognitively impaired. He has continuous racing thoughts, poor concentration, and impaired judgment. Tremendous mood swings, intense emotions, irritability, guilt, and sadness. Physically, the person goes through sleep problems, appetite change, fatigue, medication side effects. Even the medication creates side effects, and that also leads into this condition. Behaviorally, you can see that people with bipolar, they have very risky behavior, they are impulsive, they uh, uh, they neglect their responsibilities. Socially, they are very difficult in their relationships. They reduce, and all this reduce their quality of life.
Bipolar disorder classified into two categories: bipolar 1 disorder, bipolar 2 disorder. Bipolar 1 disorder features have at least one manic episode, may include hypomanic or major depressive episode but not required. Mania lasts more than 7 days or require hospitalization. Bipolar 2 disorder features have requires at least one hypomanic episode and one major depressive episode No history of a full manic episode. Hypomania lasts more than 4 days. Depression often more severe and impairing.
Yeah, seeing the two classifications, today we are going to deal with bipolar 1. So, when we think about or when we see the definition of bipolar in DSM 5, we see that according to DSM 5, at least one maniac episode is required. Second condition, during the mood disturbance, three or more of the following should be noticed: inflated self esteem or grandiosity, decreased need for sleep, more talkative than usual, or pressure to keep talking, flight of ideas or racing thoughts, distractibility, increase in goal directed activities and psychomotor agitation, excessive involvement in risky activities like spending spears or sexual indiscretions. And then you have other symptoms like causes of marked impairment, hospitalization, or psychotic features. It also has the fourth point, which says that not attributable to substance use or medication.
Now we explore the causes of bipolar 1 disorder. Genetic factors, heritability estimated at 80 to 90% of bipolar 1 disorder. Neurobiological factor, imbalances in neurotransmitters like dopamine is increased, serotonin is low, structural and functional brain changes is that in prefrontal cortex amygdala. Psychological factors, stressful life events, trauma, loss may trigger episodes. Personality traits like impulsivity or poor coping. Environmental and lifestyle factors, sleep disruption, irregular daily routines, substance uses like alcohol or drugs, social stress or lack of support. Medication related factors also included. Role of neurotransmitter in bipolar 1 disorder. In bipolar 1 disorder, neurotransmitters, the brain's chemical messengers, play a key role in mood changes. Imbalances in serotonin, dopamine, and norepinephrine are linked to the extreme high mania and low depression seen in this condition. For example, too much dopamine or norepinephrine may lead to manic episode, while low levels of these chemicals are associated with depressive episode. These chemical shift affect mood, energy, sleep, and behavior and are a target for medication used to manage bipolar symptoms.
Now, again, we come back to the treatment point. Like I spoke about MDD treatment, even in bipolar, we see that medication and counseling both go hand in hand. While medication is important, equally counseling is important. They provide effective and holistic paths to recovery. And again, the same disclaimer, self assessment is a big no no. A person cannot assess himself or diagnose his condition if it is bipolar. It has to be done under the supervision of licensed authority. So now, when I say licensed authority, then what does it mean? Whom do we go and consult? When we talk about licensed authority, there are people like psychiatrists who can diagnose MDD or bipolar and prescribe medication. Clinical psychologist can prescribe medication, but can't prescribe medication, but can provide therapy and counseling, such as cognitive behavior therapy and many other therapies that we recently discussed. We can go to general physician. General physician can be our first point of contact who may provide an initial evaluation and refer us to the um, specialist who is like a psychiatrist or a clinical psychologist. We can also go to a counseling psychologist or therapist who can offer us talk therapies, emotional support and guidance and support, and all this can support the medication. So, as I think ma'am just now spoke about the stress, the well-being toolkit, the stress-free well-being toolkit. It is one of the toolkits that offer 30 MRA techniques, and I think ma'am has given you better details about it. So all this is available at Sudisha. And apart from this, let us see the other therapies that can be used.
Yes, ma'am, it is very effective and helpful kit.
Yes.
Now, therapy for bipolar disorder. CBT, cognitive behavioral therapy, which helps identify negative thought patterns and build coping strategies. Psychoeducation, it teaches patients and families about the disorder, helping with early detection of mood changes. Interpersonal and social rhythm therapy focuses on stabilizing daily routine and sleep pattern. Family focused therapy is improves communication and reduce stress within the family. Dialectical behavior therapy is improves emotional control and mindfulness. Group therapy is provides peer support and shared experiences.
Now, when we talk about self-management, we can keep our life stable and try to bring control by sticking to a routine, taking prescribed medication regularly, tracking our mood, journaling, limiting stress and stimulants, avoiding caffeine, alcohol, practicing self-care daily, engaging in hobbies, resting, and connecting with supportive people. Now, again, story time.
Let us listen to a story on bipolar. The sky above the storm. In a quiet place nestled between hills and rivers lived a young artist named Meera. Her days were painted with sunshine and starlight, but sometimes dark clouds would gather in her sky without warning. Some days she would paint from sunrise to midnight, dancing with joy, convinced she could light up the world. Other days she could not lift a brush. Her bed felt like an ocean, and she was drowning in stillness. People did not always understand her storms, but one old man in the blaze did. He was a gardener named Arun, who had once walked through storms of his own. One grey afternoon, Meera sat by his garden in silence. Why do the storms come back, Arun? She asked softly. And how do I stop them? Arun smiled gently and handed her a small seed. You don't stop the storms, child. You learn to plant through them. This seed grows even when skies are heavy. She planted it with trembling hands. Weeks passed. The sun returned. The rain came again. Meera kept painting, some days wild, some days weary. One morning she found the plant is full bloom. Not perfect, but strong, resilient like her.
That was a lovely story, Madhvi. I'm sure it will help or give a positive impact on the clients or on the people having bipolar.
Thank you,
So
ma'am.
with this, we lead ourselves into the Q&A session. This is a this is a judgment-free platform. So I request all the audience to please post their questions without any hesitation in the chat box.
Yeah. We are here to answer.
Yes, ma'am. Ma'am, I can see extreme. I think the question is, does extreme stress cause depression? Can we get stress? Okay, this is already, I think, ma'am, you have answered.
We
Can we get?
answered. Few questions we answered.
Okay. Uh, why do some people feel very low in morning? Is it high cortisol level due to stress or some other reason?
It's not, we cannot generalize this, what I think posted. It is not, most of them feel. Some of them feel low in the morning. Some of them feel low in before they go to sleep.
Hmm.
Overthinking, uh, or feeling low along with overthinking, generally people experience in the night also. It's not only in the morning.
Mm, mm.
But definitely some of them experience this low mood in the morning because see they need to start their day. Maybe they should become functional, go to office, do some home chores. So that again, because of that low energy, low motivation, they want to do it, but they cannot do it. So that's where, the difference comes.
Okay, ma'am. Thank you for that.
But
Ma'am,
it is
next
not
question.
universal.
Okay, ma'am. Ma'am, our next question is feeling low, is it related to genetics?
See, feeling low means depression they're talking about. Is it depression or general low mood? If they're talking about depression, yes, definitely there is a genetic reason. I think you explained in a better way.
Yes.
But just normal low feeling is not genetic. It's because of many factors in the life.
Ma'am, the clarification, she's asking about general low feeling.
So generally, it's not genetic. It's like your current situation, current experiences, and current health condition. Vitamin D can cause low mood. Vitamin B12, having less B12 can also cause low mood. So you need to check your physical health and also check your, daily life around you or people around you.
Yeah, ma'am. Low mood can be, I think, controlled with lifestyle changes also. Right,
Yes,
ma'am?
and patting your five senses is the best technique. When you are
Grounding.
in the mood, pat your five senses. I
Okay, ma'am.
personally use it.
Okay.
That
Thank you, ma'am.
helps.
Ma'am, next question. What is the time period of for mania and depression and bipolar?
That Swatina should answer.
Ma'am, for mania, it is 2 weeks. And Madhvi, for bipolar, will you be answering?
And depression more than 4 days.
Yeah.
So I have seen a client who experienced this, mood swings, mania and, low mood within few minutes also. Very pathetic. It's like, complete shift in her mood within an hour also. And there are clients whom we saw 6 months of mania, 6 months into depression. So it is not very specific. It actually changes, with the person. But what DSM telling, Madhvi and Swatina will definitely help you.
Yes, ma'am.
I am talking about from my experience, not from books. Any other questions?
No, ma'am, I'm not getting any
Well
other
done.
question.
Well done. We are open for questions, but still,
Um,
it was a
Namaste, madam.
చెప్పండి.
Namaste. నేను రామలక్ష్మి.
చెప్పండి మేడం.
Actually, my mother has bipolar. I mean, she was under treatment, and my elder sister is also under treatment. So ఇది ఎన్ని సంవత్సరాలు ఇట్లా ఉంటుంది అంటే sometimes she gets worried and I mean it will be beyond control అన్నమాట. పాప పెళ్లి గురించి ఎక్కువ స్ట్రెస్ అయినా చేసినా అంటే షీఈ్ యాక్చువల్లీ వెరీ ఇంటెలిజెంట్ ఎంఎస్సి కంప్యూటర్ సైన్స్ చదువుకుంది కొన్నేళ్ళు ఢిల్లీలో షీ వర్క్డ్ విత్ రేణుకా చౌదరి గారు కంప్యూటర్ ఎవ్రీథింగ్ షీ వాజ్ ఫైన్ ఆఫ్టర్
Okay.
డెలివరీ ఆఫ్ ది బేబీ స్టార్టెడ్ అన్నమాట. ఇట్స్ ఆల్మోస్ట్ షీస్ 25 years 98లో పాప పుట్టింది. అప్పుడు బయటపడింది
Right.
2002లో బయటపడింది.
Right.
And her husband is an OCD. So almost for
Okay.
past 20 years,
Madam, let us not
we
get
had
into the
tough
personal
time.
details. Let us not get into the personal details
Yeah.
on online platform. But then your question is how long she should suffer? Is the question?
Yeah. She is under medication. She is taking treatment from NIMHAN.
Can I ask you one question? She's under medication,
Right,
but
for the past 2
is going
years.
through, is she going through therapy,
Yeah.
CBT?
3 months they go for consultation.
Once in a 3 months? Not enough. Not enough. See, medication every day, how they take,
So it's becoming
you
very
should
weak.
also send her to a therapy session.
So is
CBT
there no other
and mindful.
alternative to medication? So that is my issue.
No, I didn't get your question, ma'am.
అంటే ఇలా ఎన్నేళ్ళు ఇట్లాగా సఫర్ అవ్వటము అనేది మందుల మీద ఉంటే షీ స్టార్టెడ్ డెవలపింగ్ పార్కిన్సన్ అనుకుని రీసెంట్లీ షీ వాజ్ వెరీ మచ్ టెన్స్డ్ న్యూరో ప్రాబ్లం అది ఇది వచ్చిందంటే అది ఓవర్ మెడికేషన్ వల్ల అట్లా షివరింగ్ అది వస్తూ ఉండింది అనమాట కాళ్ళు చేతులు వణకటం అది
అదేమ్మా నా క్వశ్చన్ మీరు ఆన్సర్
ఆల్మోస్ట్
చేయండి.
షీ ఇస్ దేర్ మెడికేషన్.
No. ప్లీజ్ ఆన్సర్ మై క్వశ్చన్. మీరు ఎంత పర్ఫెక్ట్ గా అయితే
Sir,
మందులు
madam.
వాడుతున్నారో మీరు అంత ఖచ్చితంగా థెరపీ తీసుకున్నారా అని అడుగుతున్నాను.
అది నాకు కరెక్ట్ గా తెలియదు, నేను కనుక్కోవాలి మరి బాగా వాళ్ళు
రైట్. సో మై
what they
సజెషన్
are
వుడ్ బి
taking and I'm not
మై
clear about it.
సజెషన్ దట్స్ ఓకే మ్యామ్. సో మై సజెషన్ వుడ్ బి
Ah.
ప్లీజ్ encourage her to go for therapy. She should practice mindfulness, relaxation techniques, art therapy techniques, and she should also go through cognitive behavior therapy. This will definitely help her to
Okay.
control her symptoms. When the symptoms are in control,
Okay.
then they can go to the doctor and say that now I am like this, then the medication will be gradually reduced. If they are not
Right.
going through the therapy, medication will continue like that. So please encourage for therapy and do not stop medication without doctor's consent.
That's what we keep telling her. Yeah. That's what we keep telling
Okay,
her.
ma'am.
అంటే మూడ్ ఉండదు ఏ పని చేయటానికి అది ఇది అంటూ ఉంటారు.
Please,
మీరు చెప్పారు కదా మేడం వాళ్ళకి చెయ్యలేరు, ఫోకస్ చేయలేరు.
Therapy.
ఓకే మేడం, థ్యాంక్ యూ వెరీ మచ్. అలాగే మేడం, థ్యాంక్ యూ. ఐ గెట్ టు నో.
Thank you. So, right, Andy. Thank you so much, ma'am. Swatina, there was a big question in the chat box.
Yes, ma'am. It's regarding the grounding technique. Shravanti ji wants to know, may I please know the reason for why we are getting to taste different things in a session every day? And are they part of grounding technique or any specific other reason?
No. It's like, first thing, let me tell you, because I, as a therapist, working with the clients, I experience that grounding technique is really, really helpful. It is proven, scientifically proven mindfulness technique. So I thought actually we have many techniques with us. Every day we can actually give you different techniques also. But then I chose to give only grounding technique every day because by the end of this webinar series, I want all of you to get accustomed or get used to that technique. This was one major intent. But then if every day we are tasting the same chocolate, that doesn't, you do not feel better. So mindful eating of different eatables, we thought, just to add variety, just to give you taste. I'll give you my experience. There was a session where one of my therapists, see, generally my therapists are my students only. So one of my student was my therapist and she gave me 5 4 3 2 1, and that last made for taste, she gave me full glass of chilled water. And she gave me that mindful drinking, chilled water. You also do one day, one of you can take this chilled water if they are able to drink, or normal water, or little bit of lukewarm water. So that chilled water technique, when I experienced, and later that day I realized that how effective it is to drink a glass of water. And then believe me, today also, whenever I feel overwhelmed or disturbed, I just go and take full glass of chilled water, stand near my water dispenser, and drink it, and then I will be all right. So thought of giving you taste, because we never know which one will help. And my mother-in-law, she becomes normal. When she becomes very manic, we give her chocolate. Small candy will help her. So just wanted to give you a different variety of taste. That's it. No other thing.
Thank you so much, ma'am. Any more questions?
Thank you. Yeah. Good discussion today. And congratulations, Madhavi and Swatina. It was wonderful. I was listening to you from the beginning, and it was very insightful. A lot of work, creative work done by Madhavi. If I'm right, she's an artist,
Yes.
and a lot of intellectual work by Swatina. I definitely know. Both of you was a very good combination, and the webinar was really, really insightful and successful. Feeling happy, proud again, and thank you so much. Thank you,
Thank you
and
so
over to
much.
you.
Thank you for motivating us and guiding us. So we come to the end of today's webinar, but we leave you with the information for tomorrow. Day 8, we will be talking about obsessive compulsive disorder, and the presenters will be M. Pratyusha Priyadarshini and Dr. Sudhanshu Lohit. So stay tuned, come back 5:30 sharp. We will be meeting on the webinar Zoom. Thank you. Thank you so much.
Thank you,
Thank you.
everyone.